Check, check, 1, 2. Hey everyone, it's Diabetic Danica, and today I'm going to share with you some very exciting things. I am in nursing school, which you probably know already, and so I'm just going to kind of talk about what it's like to be a diabetic in nursing school. And let's see, I've been in nursing school for a month now, so I'm super experienced. Okay, not really, but considering this is an accelerated program, a month is actually a large chunk of it, and so it's all squished into this month. First, I'll explain why I'm in the nursing program, because a couple of you were like, but I thought you wanted to be a diabetes educator. I do. Actually, one of the requirements to be a diabetes educator is you have to be an RN, registered nurse, or an RD, a registered dietitian, or a bunch of other stuff. There's all these options, and I decided to go the nursing route. So you cannot become a certified diabetes educator without one of these things. And eventually I will make a video about the requirements to become a CDE, but I don't really want to make that before I've actually done those, if that makes sense. Just to make sure I definitely give you the right information. So anyway, let's get started. So the first thing about being in nursing school that I noticed as far as diabetes goes is the lows. The first week of nursing school, I went low every single night at least 2 or 3 times. And then I went low during the day at least 1 or 2 times. And you guys are probably like, Danica, why didn't you just change your insulin doses? I was changing my insulin doses that entire time. Whenever I would notice lows that shouldn't be happening, and I realized as my schedule's changing, you know, all my insulin needs are changing, I was adjusting basals and all of that, and I still went low all the live long day and night. But luckily it was the first week. I didn't have a lot of homework, so I would just kind of go to bed early and then, you know, deal with it as it came, if it came. But luckily that it's been a month now, I've kind of cruised out of that stage, and now I'm in the stage of adjusting to everything and just learning and trying to avoid spikes after meals. Because I've noticed that more lately too, and I don't know if that's related to nursing school necessarily, but I don't know. Another thing about being a diabetic in nursing school is just be prepared, if you're gonna do this, that you're gonna hear the word diabetes a lot, and you're gonna hear it meaning to be type 2, and they don't say type 2. And if you're anything like me, it's gonna drive you crazy. If it's type 2, just say type 2. But when I do have some professors that will say type 2 diabetes, and I always am so happy and so thankful for them, but when they don't, I'm always just like, urgh. If you say that obesity leads to heart disease and diabetes, please say type 2. Just please, you're killing me. It's not that hard, it's 2 words. And I'm really just thinking that now we should call type 1 and type 2 diabetes different things. Specifically, let's call type 1 autoimmune diabetes, and let's call type 2 diabetes just diabetes, because we do that anyway. Everyone knows type 2 diabetes as just diabetes mostly, and so if we just keep calling it that and we call my kind autoimmune diabetes, everyone would get it more. They'd be like, oh, it's an autoimmune disease. Okay, you mean it wasn't because you were fat. Obviously this really bothers me. Because when people think about autoimmune diseases, they think about them so much differently than they think about diabetes, which shouldn't be the case. It's an autoimmune disease when it's type 1. So anyway, just be prepared to just hear a lot about diabetes and how it's linked to obesity and heart disease and all these crazy, horrible kidney failure, blah, blah, blah. And you're just like, first of all, that's uncontrolled diabetes. Second of all, it's mostly type 2, so just get out of my brain. And a third thing I've noticed about being in nursing school as a diabetic is diabetes, I don't know, it just comes up more in my everyday conversations. I'm pretty open about my diabetes, and so obviously my close friends and I talk about it and we know about it, but it's weird because now it's such a part of my identity at nursing school, because the reason I'm in nursing school is to become a diabetes educator, and everyone I'm meeting, you know, they ask oh, what kind of nursing do you want to do? And I'm like, actually, I don't want to do nursing, I want to be a diabetes educator. And so everyone I pretty much meet knows that right off the bat, and so they figure out that I'm a diabetic right off the bat, and it's just such an instant thing that people associate with me, if that makes sense, and I'm not really used to that. So that's just been something I've been getting used to, having diabetes so core in my identity and how people see me. But you know what I'm excited for? I'm excited for Insulin Shot Day, the day in lab where we learn how to give insulin shots, because I'm gonna own that. And it was also funny, in our clinical, people were like, oh, I got to watch, you know, blood glucose checks today, finger sticks. I was like, you want to watch some more? I'm going to go get lunch right now. So yeah, so far it's been great. I mean, if you want to be a nurse or an educator or anything, definitely go for it. There's nothing that diabetics can't do except produce insulin. So definitely go for it. It's been a lot of work. It's been really, really time consuming and really intense, but I am still enjoying it and learning a lot. And I can now take blood pressure. So that's cool. And then when I'm actually in the hospital and in clinicals, what I do is I have my pump with me, of course, and I just bring my little CGM, put that in my pocket in my scrubs, and call it good. And there's always snacks nearby. I have my purse in the back room, and then also, you know, the patients have like this area of soda and everything, and yeah, always taken care of. And it's cool because I've already had a lot of type 2 diabetic patients. So if I have any other updates about being a diabetic in nursing school, I'll be sure to make a part 2 to this video at some point down the road, maybe way later when I know more and have experienced more, but so far so good. And alright, if you could just take a deep breath for me. Hello, hello. Bye. Shout out time. I have a couple shout outs today. The first one is for Type 1 Diabetes Talk on Instagram. That's T1diabetes_talk. And also on Twitter, I want to say hello to @dogs4diabetics. That is obviously a diabetic alert dog account. Hey, you guys. I also want to say hi to Kalia Henry and Robert Black. Hey, I hope you guys are doing great, and I'll catch you later. Bye. Wee.